suffer from gigantism?
Dwarfism?
60 people out of every million are said to be affected by gigantism. Can you believe those numbers? Gigantism is caused by the overproduction of the growth hormone, which is from your anterior pituitary gland.
Dwarfism is a cause that affects less than 200,000 people in the United States and across the world. It is located in the anterior pituitary gland and is caused by the underproduction of the growth hormone.
Diagnosis for the growth hormone overproduction, which is gigantism, can be achieved by a random blood test. Also, if glucose fails to suppress the high levels of the growth hormone, that is also how doctors will be able to diagnose you with gigantism.
Diagnosis of the underproduction of the growth hormone is called dwarfism. In dwarfism, there's many ways to detect it. When the baby is born, they take measurements of the body and head circumference to see whether or not the baby has dwarfism. Other ways that you can see it is by x-rays of the skull and everything else to see whether or not the calcium in the cells are actually building up. And if not, the kid has dwarfism.
Now, to say a few words, we have a victim of gigantism.
And a victim of dwarfism.
My gigantism. It does not affect my organs, but it does affect my bone and skeletal growth.
Hi, I'm a victim of dwarfism. When dwarfism in children is abnormally low in bone growth, it results in pituitary dwarfism.
Some symptoms of gigantism include abnormally large growth, above average height, really big hands, and large feet. There are no exercise changes required with gigantism, but gigantism does end up restricting movement. Diet changes, there are none. Doctors do not require victims of gigantism to get on a diet program. Sexual changes, though, are prominent. Women who are having gigantism will have irregular menstruation cycles. And both sexes, as they reach the age of puberty, will have irregular maturation of their sexual genes.
Symptoms of dwarfism is extremely short stature, big eyes, small fingers and small toes. Also that's there is the sexual changes that are there. They have extremely small organs and they also are unable to have a baby. Other things that are there also the doctor recommends is that they eat lots of calcium and also do lots of physical exercise that is needed. And that's it.
Treatment for gigantism has a wide variety of ranges. The number one and first option is always to try and surgically heal the gigantism victim. They aim to remove the adenoma or tumor that is on the pituitary gland. But most of the time after the surgery, or surgery cannot be attempted, they must go for radiation therapy, which is also used to treat gigantism. Lastly, and usually not a very common option, is drug therapy, where they give gigantism patients a wide variety of pharmaceuticals.
The treatments for dwarfism is that doctors try to enhance the bone density by giving certain medicines that can increase the calcium intake. Also, doctors try to surgically increase the secretion that is in the anterior pituitary glands of the growth hormones.
So please, raise awareness for gigantism. This is what I challenge you to do.
And please, raise awareness for dwarfism. It is a challenging thing, but it's not a small thing. It's a big thing.